Yes, you're welcome. Today we're going to talk about typhoid fever, also known as enteric fever. So let's define typhoid fever. It is an acute bacterial disease characterized by fever, abdominal symptoms, and spread through contaminated food and water. The causative agent of typhoid fever is Salmonella typhi and Salmonella paratyphi A, B, and C. So the route of transmission is fecal oral route, and fecal oral route is spread of microorganisms from infected stool of one person into the mouth of another person. Then Salmonella paratyphi and Salmonella typhi, they are all gram-negative bacteria. So let's see the pathophysiology. The pathophysiology, after ingesting contaminated food or drinking contaminated water, the bacteria invades the small intestinal mucosa. Then it is taken up by the macrophages as an engulfed and transported to the regional lymph node tissue. And the lymph tissue here is the Peyer's patches. So Salmonella typhi will multiply in the intestinal lymph node tissue, and after multiplying from a period of 1 to 3 weeks, we shall have diarrhea coming in as a sign. Then by the end of the incubation period, the bacilli will enter the blood stream. Remember, this time it has multiplied and it is large quantities or high numbers, so it will enter the blood stream and invade some organs of the body, that is the gallbladder, the biliary system, and many other systems of the body and organs. Then in the gaiety, it is passed out through stool. That's why we can do a stool culture and we confirm whether you have typhoid. Then in the clinical manifestations, so here we are talking about the signs and symptoms. So here when we are talking about the signs and symptoms, we shall group them into 4 stages, and each stage lasts for at least 1 week. The first sign we shall talk about in the first week is the rising temperature, and these are in the step ladder form. Then we shall have bradycardia, weak and slow pulse, malaise, which means general body weakness, then headache, restlessness, cough. Then we shall have epistaxis, and epistaxis is bleeding from the nose. Then abdominal pain. There is also reduced white blood cells, which is leukopenia. Then eosinopenia, which means reduced eosinophils within the blood. Then the widow test is negative in the first week, but the blood culture is positive at this stage. Then in the second week, the patient becomes very sick and the temperatures increase. At this time, the temperature is 40 degrees Celsius. Then there is delirium, and delirium means disturbance in mental abilities. Then the patient might become all agitated. Then rosy spots. These are red spots, and most times they are found on the lower chest and on the abdomen, and it comes in third of the patients. Then abdominal distension and tenderness in the right lower quadrant. The patient may experience diarrhea, and the stool has that pea soup like smell. Then however, also constipation is also frequent. Then remember, we are still talking about the second week. There is hepatosplenomegaly. Hepatosplenomegaly means enlargement of the spleen and the liver, and at this time the widow reaction is strongly positive. Then still in the second week, there might be rattling breathing sounds. Then the rattling breathing sounds can be heard on auscultation. Then in the third week, at this time, many and most of the complications will occur due to the eroding of the dead fragments. Remember, we said the Salmonella typhi will invade the intestinal wall, meaning those dead tissues have to be eroded, and in the process of being eroded, it will cause perforations. Perforations will also cause hemorrhage, and still with the perforation, it means stomachal contents, or the intestinal contents can enter the peritoneal cavity, and this will cause peritonitis, which is inflammation of layers of the peritoneal cavity. Then encephalitis, which is inflammation of the brain, cholecystitis, inflammation of the gallbladder, and these we shall talk about them in the complications. Then dehydration may also set in. Then by the end of the 3rd week, the patient is emaciated. Then in the 4th week, which is the last stage, the fever will disappear or decline, and it will return to normal. So here, if the patient is not treated, 25% of these patients, they die. But with natural immunity in the 4th stage, meaning the patient will recover. So differential diagnosis. Differential diagnosis, we shall talk about all conditions, or most conditions, which increase the temperature, where we can talk about malaria, typhus, fevers, and many others. Then investigations. The first investigation we can do is stool culture. So here they will pick your stool and take it to find which microorganism is there. Then we can do a blood culture, which is the most reliable. Then we can do the rapid antigen test, and in this we have the Tubex, and then lastly we can do a window test. But with the window test, it is neither sensitive nor specific for the diagnosis. So doing only a single test and it is positive does not confirm the presence of the infection. So management, how can we manage this patient? For admission, it is recommended for patients with severe signs and symptoms like vomiting, diarrhea, severe diarrhea, and swollen abdomen. So if we admit this patient, how do we position? Most times in a comfortable position, but according also to the signs and symptoms. Like a patient who will come with difficulties in breathing, we shall at least go in for a sit-up position. Then observations, and in the observations, first is doing the vital observations, where we have temperature, pulse rate, respiration rate, and blood pressure should be monitored regularly. Then general observations, like you have to observe or assess the patient for dehydration, jaundice, and many others. Then we go for the specific nursing care. This is the care given before we initiate treatment, as in we initiate in drugs. So this treatment, most times it is symptomatic. Like for fever, we can tapid sponge the patient, we can reduce the bed linen, we can open windows of the ward. For dehydration, we can rehydrate the patient using ORS, then other intravenous fluids. Then we have to do observations, that is TPR, BP. 4 hours. Remember, in the signs and symptoms we talked about bradycardia. How will you know that this patient has bradycardia without taking the vital observation? So we have to be doing them. Then institute a fluid balance chart to prevent fluid overload. Remember, we are talking about rehydration, so there is a possibility of fluid overload. Then give health education to the patient about personal protection and prevention of typhoid. And the patient should rest for at least 1 to 2 hours to avoid side effects of the drugs, like dizziness, vomiting, and hypotension. So if the patient is unable to eat or drink, pass a nasogastric tube. Then ensure proper hygiene of the patient and the whole environment. So drugs, pharmaceutical therapy. Most patients will be treated using ciprofloxacin, but now there is some resistance with ciprofloxacin. Ciprofloxacin we give 500 milligrams every 12 hours for 10 to 14 days. Then for children, 10 to 15 milligrams per kg body weight. Then we can also use chlorphenical 500 milligrams 6 hourly for 10 days. Then In children, 25 milligrams per kg body weight. We can give it IV, IM, or oral for 10 to 14 days. But remember, ciprofloxacin is not recommended for children. Chlorphenical is not also recommended for children because it causes bone marrow suppression. Then, in severe conditions, then those who are resistant to like ciprofloxacin, then all pregnant mothers will give ceftriaxone 1 gram IV 12 hourly for 10 to 14 days. Then in children, we give 50 milligrams per kg body weight. Then an alternative in pregnancy, we can give amoxicillin 1 gram every 8 hours for 10 days. Then for children, amoxicillin we shall give 10 to 15 milligrams per kg body weight. Then we have we have those patients we call carriers. For carriers, they are treated for 4 to 6 weeks, that is over 1 month and a half, or from 1 month to 1 month and a half. They are given ciprofloxacin 500 to 750 milligrams every 12 hours. Then for children, 10 to 15 milligrams per kg body weight. Then exercises. Which exercises should the patient do? We have no limitations of which exercise the patient should do. Then the patient should rest. Then mobility is maintained if it is tolerable. And for the diet, we encourage the patient to take a high calorie diet to gain energy and increase the strength. These patients should avoid the raw, unpeeled vegetables that have been washed with contaminated water. The safest way is washing these fruits with uncontaminated water or safe water. Then the advice on discharge: the patient should be encouraged to stay at home until full recovery. Then drug compliance, that is finishing treatment. Then health education. So we talk about the complications. Perforations, we saw how the perforations come in because the bacteria eats up the intestinal walls, which will cause perforations. It will still cause hemorrhage, still it will cause peritonitis. How does cholecystitis come in? It's because after replication it will invade organisms, and in the organisms the organs, and in the organs it invades. There is the gallbladder. So inflammation of the gallbladder is cholecystitis. Then pneumonia, inflammation of the lung, parenchyma. Heart failure, failure of the heart to pump blood in its usual way. Osteomyelitis, inflammation of the bones due to infection. Then encephalitis, inflammation of the brain. Meningitis, that is inflammation of the meninges. Then lastly is mental confusion. How we get all these complications? It's because this bacteria spreads within the whole system of the body. So by the end of the day, it will cause inflammation. So let's talk about the prevention. How do we prevent typhoid? Through good hygiene, that is personal hygiene, hand washing from the toilet after cleaning diapers and others. Use of safe water, that is through chlorination and boiling. Proper fecal disposal, that is disposing of. The best way of disposing of is disposing of the fecal matter in the toilet or latrines. Then good food hygiene, that is washing all food and cooking, thorough cooking of food. Then early detection, isolation, treatment and reporting. When we treat, we have stopped the spread. Then lastly, we can immunize these patients. We immunize people before they go to high risk areas. So then, thanks for your attention. Please share to friends, and please don't forget to subscribe and turn on notifications. Thank you.